Real pleasure to be here today with you all. Thanks so much for the invitation to share a little bit more about Digital Health Canada, your professional association for digital health in Canada. And I'm just going to see about sharing my desktop screen here. Can everyone see that presentation slide now? Look, this is an incredible time for digital health and health in our country. And the fact that we have a group here today, as I can tell and have been advised, of computer science professionals, data professionals, clinical leaders, operational leaders, scientists who are coming into this particular program to learn more about data science and health and the use of AI in health bodes very well for the future of health in our country. We've moved through a very challenging year and a bit, as I'm sure you've all touched in different ways, and it's touched all of us in really challenging and negative ways. But certainly now more than ever, Canadians, citizens as well as professionals, are aware of the opportunities that digital can provide us, and the opportunities to deliver health in our digital world are tremendous, and we need all of your help and your knowledge, insights, and experience to really tackle this head on. So my goal today is, within this short time, just to introduce you to our professional association, Digital Health Canada, which in a lot of ways is a great introduction and orientation to the ecosystems that exist across our country in the health space. I'll talk a little bit as well about the opportunities for use of data science, and AI in the space, primarily by sharing with you some of the challenges that our members and member associations bring forward from a clinical and healthcare perspective that require further innovation, further help from the science of data and analytics, and the use of technologies like AI and machine learning. And we'll talk more about your opportunity to expand and engage in the health and healthcare space through resources we make available as your professional association around developing your career as a data science professional, as an analytics professional, as a leader in the health and healthcare industry. So our association, we're more than 45 years old, started in 1975, and really have grown with the incredible growth of the use of technology and information as the health informatics science has grown, as through decades of research, through decades of practitioners and operators and business leaders coming together with clinicians to evolve this science and this profession. Our mission is to connect, inspire, and empower digital health professionals who are creating the future of health in Canada. And our vision is to catalyze the digital health community. So as you can imagine, our members are a diverse community of accomplished professionals working across Canada to make a difference in advancing healthcare, as I mentioned, through information, through the use of technology, through the use of data management, all with the goal of optimizing the delivery of health services, improving access for Canadians to gain access to their data and to health services, to improve the working conditions and operating conditions for our clinicians, and to engage patients, of course, while delivering better health outcomes. So our members are supporting that work through the use of information technology and data management. As I said, the association began in 1975. We have over 3,000 individual members from 140 organizations. You may know us from events like the annual eHealth conference and trade show, which is run for over 20 years. And we've been virtual for the last year, but look forward to getting back to the large trade center in Vancouver, as well as getting back to Toronto for in-person connections with over 1,500 attendees, including our poster presentations that I know many of you have participated in and presented in from an academic standpoint. We also offer a chief executive program, the Executive Forum, which brings together leaders who are CIOs, data professionals, clinical leaders, as well as vendors and innovators in the space of digital health. Weekly, we have a webinar series that offers insights into projects, programs, and innovation that's happening across the country that brings together thousands of attendees through the year. And of course, our publications, white papers, research, as well as forums that set out to work on challenging questions, research questions, as well as program areas that are relevant for the complex challenges that our stakeholders face. We have a strategy for 2023 that includes priorities of empowering individuals, that includes knowledge sharing and lifelong learning, and advancement in advocacy. And as your professional association, it is our mission to ensure that each individual is successful, well-connected, and able to thrive in the industry. And so as you come into health, as many of you are from computer science, from math programs, stats, epidemiology, it's our objective to create those on-ramps and connect you deeply and broadly with professionals across the country who can help to share the challenges they face, the data sets they're working with, and the multidisciplinary collaborators that you need to be successful in your work. I should also point out, and we'll talk at the end as well, about career progression. And as a professional, there are certifications you can pursue, like the Certified Professional in Health Information Management, CPHIMS-CA with a Canadian perspective, as well as other professional credentials that we offer. And we work with members shoulder to shoulder to create micro-credentials and professional credentials. It's really important as you think about the data world that we live in health, to recognize the diversity of the ecosystem. I mean, 10 years ago, when you talked about health informatics and digital health in Canada, the ecosystem was, by today's standards, relatively confined to care settings, especially the hospital that were collecting large amounts of data, provincial repositories, and vendors like electronic health record systems that were deployed in large centralized ways across the country. Fast forward to today, health data exists all around us in a massively decentralized fashion, everything from those provider-based records to the data that's residing in tools that you're wearing on your belt, insulin pumps, continuous glucose monitors, home blood pressure cuffs, phones, wearable devices, through to community care centers, primary care centers, and increasingly in the workplace. We have many members now who are focused on reaching citizens not only through the traditional healthcare system, but also through the workplace and providing access to virtual care and health resources, to remote monitoring tools and connected technologies that allow Canadian citizens to be active and engaged in their health. This provides huge opportunities, but our members would say also that this provides huge challenges. There's a growing need for more seamless interaction, more access, more connectivity between providers and patients. This has always existed, but increasingly we're doing this in a low resource environment, whether it's from fiscal constraints and financial pressures, resource constraints and pressures, and just connectivity challenges that exist across our health system amongst all of the siloed organizations that have yet to connect and be sharing data for informed, rapid decision making. These same tools, though, that provide us barriers can also make information sharing opportunistic for us. And these are some of the areas where our members are working and would love to engage with this group here in terms of connecting some of those cases and some of that work together. So our members really come together in working groups and are opportunistic about trying to solve the big complex challenges that exist in healthcare. And for those of you who have worked in other industries, financial services, retail, and applied, the computer science, the engineering, the epidemiological backgrounds, when you're coming into healthcare, you're recognizing how complex these journeys are. Our members have shared with us through survey, through focus groups, and just day-to-day working groups, some of the key challenges that exist. And this is certainly very high level from a 2021 standpoint. But right now, most of our members, Canadian healthcare professionals, are focused still on pandemic response, vaccination, rollouts, continued management of population health, continued assessment of researching and understanding both the treatment of the COVID-19 as well as optimizing the rollout of vaccinations and continued program support from those perspectives. There's been a lot of work from a standpoint of virtual care implementation around delivering care through the pandemic. And now much work is needed to continue to say, well, how will this continue? What standards need to be implemented to allow for not only the continuation of virtual care, but increasingly the standardized delivery of virtual health and care and the connectivity from a multi-organization or jurisdictional standpoint. So there's a lot of strategies evolving in the area of virtual care at this stage that do require data science approach, that do require a better understanding of all of the elements that are required from a connectivity and certainly from an integration standpoint. When I say integration, of course, everyone initially thinks in the digital health realm of technology and information in terms of integration, connectivity between systems, standards for data sharing, but it's also integration from a clinical standpoint that's primary and of primary need. And our clinical leaders are reminding us constantly that as data and digital health and health informatics professionals, that we need to clearly understand the challenges that exist and deliver on those opportunities for clinical integration from that standpoint. And then workforce is a huge challenge. And this is an area where a lot of the business cases exist around AI currently and machine learning, is the fact that coming into the pandemic, Canada and our jurisdictional health delivery systems already faced significant challenges from a human resource standpoint. Being able to deploy people in a way that met the need and the growing need, as we have an aging population, for health care and health service delivery and access to those services through the many geographically diverse communities that exist across the country was a huge challenge. The pandemic has exacerbated this challenge because of the fact that more care is required more acutely across the country and across all jurisdictions. But also, we now have a rapidly fatiguing workforce. We have challenges in terms of not only replacing and replenishing those frontline care providers who've been working full steam for months, in fact, over a year, and are looking to take a break. We've seen survey data that indicates that there are many clinicians who are looking to step away from frontline care delivery. And there are a lot of executives in the health systems across the country that have a major concern around their workforce. What are the opportunities for AI? What are the opportunities to help to facilitate care delivery through the use of tools that can assist clinicians and augment their work at the front line from a care delivery standpoint is a tremendous business case and a question for computer science, stats, and epidemiological professionals to explore from that AI machine learning perspective. Over the past year as well, our members have tackled and are looking at a variety of opportunity areas that have been put under a spotlight through the pandemic, including virtual health and care services, the shifting focus to in-home and community care. Our members have put together a virtual care toolkit that includes a maturity model for virtual care and mapping your virtual care programs across the country, as well as a standardized lexicon so that a team working in the Lower Mainland, Vancouver Island, can share and exchange information with professionals working in Atlantic Canada or in the prairies or in Ontario, and talk about the same work using different terminologies, different lexicon. The data decision-making and acceleration of digital transformation. There are many more organizations and teams now across the world of health and healthcare in Canada who are taking a digital-first mindset. And gone is the idea that a strategy could be deployed, a program could be developed, and then there could be considerations put in place for how might we digitize the program? How might we create tools for patients to access from the convenience of their home or from a mobile standpoint? Digital is now is a digital-first mindset. It's a digital doorway mindset. And each organization is working on strategies and implementing programs from that perspective, which in turn creates a real challenge in terms of the data that's available. How can organizations securely access and share data? And one of the key ideas I want to plant and leave with you today, our members have been discussing, is the notion of shifting the risk profile of data sharing from one of having the board and executives around the table thinking about data from the standpoint of ensuring that it's locked down and secure, which is obviously of critical importance. And we know this as there's increasingly cyber security challenges and more criminal activity around the use of cyber breakdowns, as well as challenges from that standpoint. But flipping this to think about data sharing from the standpoint of, it's a huge risk if your organization is not looking at how to share data. And increasingly, organizations across the country are mapping risk profile in terms of, is our organization looking to share data with other organizations in the community? So that's been one key change we've seen through this pandemic. As well, digital literacy and equity, the importance of the digital divide on vulnerable populations. For those of you who are in the field of access to data, looking at tools and resources for improving Canadian citizens' literacy on how to engage with their health data, the time is now. There's never been a more critical need for this work that's happening across the country. Our membership, especially through our Chief Executive Forum, has been working on this for a number of years. And this community has identified through several white papers and thought leadership pieces, which you all have access to as members of the association, looking at creating a unified, proactive community around data in Canada, and a set of actions that can be taken immediately and adopted by professionals, leaders, and organizations across the country to begin to unlock the value of data and begin building business cases for data sharing, and increasingly projects and programs about readying data at the organizational level, engaging stakeholders, and reframing the challenges that exist around data sharing as opportunities. We also had a paper that was done on perspectives on AI. This dates to 2018. And at this point, our Chief Executive Forum group is looking at this with fresh eyes and fresh perspective in light of some of the work that's been going on across the country, including the work that's happening at PHAC around the vision for the Canadian health data ecosystem and a pan-Canadian health strategy. Certainly, you just heard from Infoway, who's doing a lot of work in this area. We're collaborating there, as well as with CIHI on health data. PHAC has been driving forward this expert advisory group that's provided a number of recommendations, and I'm sure many on this program have had a chance to look at the expert advisory group report. Many of you maybe are engaged with this group, but I suggest again another resource to take a look at as this builds momentum towards the full report at the end of this fall for the recommendations coming forward around building a vision for integrated, continuously optimized health data ecosystem. A great mission, but certainly one that we need to tackle together and collaboratively in order to build out our digital health service delivery models in Canada, as well as improve on the outcomes from an experience as well as a clinical impact standpoint. Just noting a few resources as I wrap up here that are useful, especially for those of you who are beginning your journey into the health and healthcare space. We have a matrix that you may find useful, developed by professionals and continually updated by professionals and volunteers across the association, that outlines domain areas across the top, everything from clinical health services all the way over to patient-related and product management, information technology, the analytics space, information management space, and orients these along a left-hand axis there of emerging professionals coming out of school and undergraduate and graduate programs, all the way up to the master level for those who've had significant experience in the industry or related fields. These map out job titles. Each of these is backed by a description, skills, experiences, and training, as well as credentials required to meet those needs. This is an ever-evolving space in terms of mapping out the career profiles. We're now moving from a very linear perspective on this to much more of a journey-based perspective, where we do have professionals, as I noted at the beginning of this call, coming into join health after a decade or more of experience in computer science or in engineering. They've had a challenge for themselves, a family member in the healthcare space, and have really decided to apply their knowledge, their insights, and their skills to improve patient experiences and work towards seamless interactions in health in Canada. And so I suggest you take a look at this. We'd be happy to talk more about certifications, including the CP-HIM-CA certification for those of you who are looking to build your credentials and CV in the health and healthcare space in Canada. And with that, I'll close out. I want to thank everyone today, and certainly point you towards the association, our digital doorway, digitalhealthcanada.com, where you can connect and engage with like-minded professionals from across the country.